Welcome to the Live to 110 podcast. My name is Wendy Myers, and you can find me at live to110.com. And you can find this video podcast on my YouTube channel, Wendy Live to 110. Please go there and subscribe. I have lots of videos there for you, all kinds of educational materials. And you can also find this video podcast on the corresponding blog post on the website live to110.com. Today, I'm so excited. We have Dr. William Shaw on the podcast. He is the founder of Great Plains Labs. They're one of the labs that I use as a functional diagnostic nutritionist to test for all kinds of things. They have some of the most advanced tests on the market today, including testing for oxalates. We're going to be talking about oxalates on the show and how very prevalent they are and how they contribute to so many different health conditions, so many different vague symptoms. And most medical doctors, it's just not on their radar at all, especially if you have a pain syndrome or chronic fatigue, autism. 80 to 90% of children that have autism also have oxalate issues, causes them a lot of health problems and pain, etc. So we're going to be talking about what causes oxalates, what they are, and what you can do to reduce them in your body via supplementation and diet. But first, we have to do the disclaimer. Please keep in mind that this program is not intended to diagnose or treat any disease or health condition and is not a substitute for professional medical advice. Please consult your healthcare practitioner before engaging in any treatment that we suggest today on the show. And I'm so thrilled that my Body Biorehab program is launched. Go check it out at bodybiorehab.com. I get a lot of basic questions about health. I get hundreds of emails every week of people asking me how much should I exercise? What kind of exercise should I do? What's the best diet? And lots of questions about the most effective means of detox, etc. So I wanted to create this online program to answer all of those basic questions. And it's a very comprehensive program with 5 different modules: diet, sleep, stress, exercise, and detoxification. And there's a video for every single module, lots of reading and videos, etc., to help to educate you. Also, lots of program materials and workbooks, 30-day meal plan, etc., to help you get on track and on the road to wellness. The program absolutely will help you lose weight, increase your energy, reduce brain fog, and get you the health results that you seek. So go look at it at bodybiorehab.com. You can also check out my healing and detox program, Mineral Power, at mineralpower.com. This is the number one thing I do with all of my personal clients that I work with, is to start with a hair mineral analysis and get a complete health history of my clients to figure out the best course of action to eliminate their health symptoms and to reverse disease. It's a very comprehensive program that entails customized supplements targeted to your body chemistry. Definitely detoxification. You have to address detoxification if you ever plan to be well and have the energy that you enjoyed as a youth. In our toxic modern world, if you don't have detox in your health regimen, you are not going to be healthy. It's just not possible today. So go check that out at mineralpower.com. Our guest today is Dr. William Shaw. He is an American chemist, autism researcher, and the founder of the Great Plains Laboratory. Shaw has a bachelor's degree in biochemistry from the University of Georgia and a PhD from the Medical University of Southern California, and also one in biochemistry. After obtaining his PhD, Shaw spent 6 years working at the Centers for Disease Control and Prevention, where he was a supervisory research chemist and the chief of the radioimmunoassay laboratory. His laboratory, the Great Plains Laboratory, which he founded in 1996, specializes in metabolic and nutritional testing, particularly as it pertains to autism. Dr. Shaw, thank you so much for coming on the podcast.
My pleasure.
Why don't you tell the listeners a little bit about yourself and how you got into research and what you're researching now?
Yeah, so the company that the president of Great Plains Laboratory was started as a result of a lifetime goal of mine. When I got out of school, I thought that the technology of mass spectrometry was just becoming widely available, and I thought if you were able to test urine samples, you'd be able to, in essence, learn every single thing about a person's physiology, and by knowing every single molecule, you'd be able to know what was causing their illness. And with that knowledge, you'd be able to institute a treatment based on those abnormalities. So that was, just getting out of graduate school. That was my goal, and it took a lot longer than I anticipated to realize my dream, but eventually I got there, and largely accomplished that, which is a nice thing to do.
Yeah, I love your lab. I'm an FDN, so I do all of your
Uh-huh,
testing. I love the fatty acids profile and
uh-huh,
the oat, the organic acids test, and you have a
uh-huh.
lot of really great tests. The metal and mineral RBC test is great as well. But let's talk about oxalates. I want to focus on oxalates
Yeah,
because I'm really surprised by how many clients that I'm testing that have oxalates. So, can you tell the listeners a little bit about what oxalates are?
yeah. So oxalates are a small molecule, and they form crystals. And probably a lot of people have seen oxalates. If they've walked out in the woods sometime, there's some yellowish mold growing at the bottom of dead trees. It's very common for mold and fungus to make oxalates. And if you go into moldy buildings, like at the fort at Old San Juan, I saw some black mold on the ceiling, and you could see like stalactites coming down, and more than likely, those were stalactites of oxalates. So they're produced by mold, fungus, and probably candida. But the human body also produces them as a waste product. They are sometimes they'll get into murder cases. So there was a case where one physician got mad at her boyfriend and put antifreeze in his coffee. And the antifreeze is not toxic itself. It's toxic because it's converted to oxalates. That's what makes it poisonous. As a result of that, the the these one of the consumer groups made a very bitter material that has to be put into antifreeze to prevent poisoning like that. So it's a very toxic thing. It's one of the most common reasons that cats and dogs die in the wintertime, because a car may have a leaky radiator, and the ethylene glycol, which is in the antifreeze, is very sweet tasting, and so they lick it and then develop the oxalate crystals and die. So it's a very toxic compound. Uh, there are, with different chemicals, they have these sheets they call MSDS sheets. So every chemical that's produced has to have this fact sheet on what the substance is and what kinds of harm it can cause you and how much it would take to kill you. And if you look up the oxalate MSDS sheet, you'll see that it says between 500 to 1500 milligrams of oxalate can be lethal. What's interesting is this is the same range of oxalate that's found in the common green smoothie.
Uh,
It's exactly that
wow.
same amount. So rather than being a health food, I would call it a health catastrophe food. Anybody who's taking these on a regular basis, it has the possibility of radically altering their health for the worse. So, in addition to forming in the kidneys, these oxalates can form in all the tissues in the body, and they can form in the brain, in the thyroid, in the liver, in the skin, uh, in the heart, and they can cause atherosclerosis. As a matter of fact, I strongly suspect that the oxalate problem is probably a more important factor in atherosclerosis than cholesterol is.
Yeah.
And so this is just has to do with fads and trends in the medical field. You know, you got this huge number of researchers working on cholesterol, and of course, the more they work, the more grants they get, and then the more drug companies become see it as a profit potential, and pretty soon you have all these a huge number of drugs for lowering cholesterol, and yet I think there are other factors that are equally or more important in the treatment of many diseases. But it's called the pylon effect. Once somebody gets into a field, a whole bunch of people do it. I mean, it's just like hula hoops.
Yeah, so how prevalent are oxalates? Because, like I said, I'm surprised by how many of my clients have oxalates. I was convinced I had oxalates, but I did an organic acid test, and I don't have them. I was very, very happy
I'm
about that.
glad that you don't have it. So I bet you're not one of those people drinking green smoothies every
No.
day.
I did that for a while, and I didn't feel great after doing them. I did them for a couple years, and I just didn't see an improvement in my health, and they were pretty disgusting. So I stopped drinking those, and
Yeah,
I don't recommend them to clients either.
yeah.
But so, how prevalent are oxalates in our society?
I think that they're extremely prevalent now because of these health fads. I did a Google search and there was 609,000 hits for green smoothies, but I think there were only about three hits for the toxic effects of oxalates that might be in the green smoothie. So, so it really is a huge fad. In addition to that, is the spinach salad. I don't know how many people have come to me and said, I wanted to make a shift to better food in my diet, to a healthier diet. And they perceived that a healthier diet was something that tasted really bad, which was a huge bowl of raw spinach. And sometimes they topped it off with other high oxalate foods like berries and nuts. So they had like the perfect storm for a high oxalate diet. And virtually every one of those I talked to ended up with kidney stones,
Hmm.
not realizing that it was related at all. You
Yeah.
know, a lot of people, they when they hear that something is healthy, they don't question the source, and it is it's purely a fad.
Can people tolerate those foods on occasion, say if they have a healthy gut and they don't have tons of yeast and mold, etc., in their body making oxalates?
Well, a lot of the oxalate is right in the food itself, though. So for example, the I became extremely interested a number of years ago, but then recently found out that there was research from about 75 years ago that was done by the Campbell Soup Company. So they were food chemists and they wanted to see, you know, what vegetables should they put in the Campbell's vegetable soup. And so they said, well, we better check it out and make sure they're really healthy. And they put rats on different diets, and the one that was high in spinach was remarkable because a high percentage of the rats died on a 10% spinach diet, and their teeth got loose and fell out. Their bones became extremely soft, and they found it impossible to reproduce. So oxalates were so because of that they I think they decided that putting a lot of spinach in their soup would not be a good move, and so it's sometimes very worthwhile to go back to the older literature. You know, a lot of people think, well, if an article's old, it must be out of date. But if the science is done well, you know, Mendel's laws are still in effect, even though the experiments were done 150 years ago. They were done correctly and rigorously, and they're still in effect. Even old doesn't mean necessarily out of date.
Yeah, our bodies don't change.
That's right. We
Yeah.
have, very close to the same DNA that our ancestors had 50,000 years ago. We haven't had that much change in our underlying genetic material.
So, what common chemicals can cause excess oxalates that people may be unaware of?
So the biggest thing is the food, and in addition to spinach, there's some that are similar to spinach, arugula and Swiss chard are also very high in oxalates. And the difficulty is that these aren't things, there's some things if you cook, you denature the thing, but oxalate isn't one of them. So oxalate is a very sturdy molecule, and you could boil it for days, and it's still going to be just as toxic as it was prior to starting the cooking process. The only advantage in cooking would be if you boil something like spinach for a long period of time, a lot of the oxalates might go into the water. So oxalate is very insoluble, but it would be more soluble in boiling hot water. And so by boiling it extensively and chopping the spinach into tiny, tiny pieces, you could probably take a lot of the oxalates out. But you can't do that with a spinach salad. A spinach salad, you're going to get a huge chunk of the oxalates that are in there. Another source of oxalates that you have to be aware of is high doses of vitamin C. So when vitamin C decomposes, it can form oxalates. And the literature, the medical literature, is controversial. Some articles indicate that even 500 milligrams, greater than 500 milligrams, might result in increased oxalate, whereas others indicate you have to exceed 2,000. And what I suspect it's a biochemical individuality that some people don't form oxalates from vitamin C until it gets to very high levels, and some people will. And one of the important factors are if the person has excess iron or copper. It accelerates the breakdown of vitamin C to form oxalates.
Hmm.
So that is a very important factor. So I became embroiled in some controversy because one of the prison systems in the United States, the Illinois state prisons, decided they would save money by not giving the prisoners meat, and they were going to give them soy protein in place of meat. So they were giving them soy burgers and soy turkey, and
It's akin to
and
torture.
and also giving them soy bread and soy cookies, and they were coming down with terrible illnesses and heart disease, and so they've actually uh, initiated a lawsuit against the prison system. So these individuals suffering uh, were just not eating the prison food at all. Prisoners are able to make some money in the prison shops, and they were just eating the junk food in the prison commissary. They preferred that to the toxic oxalate diet they were getting from the state. So that's still ongoing. As far as I know, that lawsuit hasn't resolved yet.
So, soy is high in oxalates as well.
Yes, so soy is another one that soy and spinach are so high that I actually think they're not suitable as human foods.
Mm.
They really, if you use spinach at all, I would say use it as a garnish, like people use parsley. So eating a very small amount isn't going to be harmful, but any large portion, the oxalates in there are so high that not only the oxalates toxic, but they also bind the person's calcium and magnesium and zinc and other essential elements, and keep the person from absorbing healthy minerals. So even though there's some beneficial elements in spinach and soy, the the fact that they are chelating agents prevents them from being a healthy food. So the amount of protein, of course, in spinach is negligible. Soy does have some protein, but the amount of oxalates are just gigantic.
Yeah, yeah, I stopped eating soy a long time ago for many, many different reasons. But let's talk a little bit more about vitamin C. So you said vitamin C can turn into oxalates in some individuals.
Yeah.
Should it be completely avoided if you have oxalates?
I think I would just recommend keeping the intake to 500 milligrams a day or less. I think that you would be pretty safe in most cases. I do know of in some of the applications where it's used intravenously, absolutely gigantic values like 100 grams a day are sometimes used in an infusion, and I think that could be toxic, and it could cause some kidney stones or oxalates depositing in other tissues as well.
Yeah, I agree. I think that it's just crazy to do mega dosing like that of any nutrient because our body only absorbs so much
Uh,
at one time. So, what about the differences between food-based vitamin C like amla or camo camo,
uh-huh.
liposomal or just plain old synthetic ascorbic acid? Do all of these forms turn into oxalates?
Yes. So once these forms of vitamin C are absorbed, they're all basically going to be converted to the same biochemical form, regardless of whether you take the buffered form or the plain ascorbic acid or ascorbate. Once they're in the body, they're pretty much going to be converted to exactly the same thing. Um, so so I've cut back. I used to recommend much higher doses of vitamin C, and since learning this information, I've been more conservative about the doses I've recommended. Like I said, I don't know whether this happens in every single person. The major factor is, does the person have excessive copper uh, and and or iron in their bloodstream? If they have the excess free copper or free iron, this could be toxic.
Yeah. So you would recommend much lower vitamin C for these individuals?
Yeah.
Okay. So no vitamin C or just lower, like maybe 100, 200 milligrams?
No, I think I'd feel comfortable going up as high as 500
Okay.
milligrams.
Okay,
I
great.
think for an adult, and then of course for children, it would be scaled down proportionally by body weight. Say, assuming an average adult is 150 pounds, so if you had a 75-pound child, you would use, say, 250 as a maximum,
Okay. And let's
something
talk,
along those lines.
okay, yeah, and let's talk about some of the health conditions that can be caused by oxalates.
Uh-huh.
There's lots of different health conditions that can be exacerbated by oxalates. Can we talk a little bit about those?
Yeah. One of the most dramatic is autism. So about 90% of children with autism have elevated oxalates. And it was kind of interesting when I first started doing research in autism, I had noticed that, but it didn't publish the results because I just thought it was impossible. And later on, there became additional people who were reporting that, and I felt comfortable releasing my earlier data on that. And it's been found that reducing oxalates by, a variety of techniques helps tremendously with the symptoms of autism. Many of them have gastrointestinal symptoms, but it also helps behavioral symptoms and increased learning ability. So oxalates can form anywhere in the body, including the brain and the blood-brain barrier. And when they do, they can impair the function of whatever tissue they form in. They can short circuit nerves because if the oxalate crystals are blocking a nerve pathway, then that nerve signal may not progress.
Yeah, and they can really gum up your methylation cycles as well, correct? And prevent you from detoxing.
The oxalates can be a major problem as far as detoxification. And the biggest problem with oxalates is that they are extremely powerful chelating agents. So ordinarily you might think, oh, that's good. But unlike therapeutic chelating agents that take heavy metals out of the body, oxalates trap heavy metals inside the body. So when oxalates have the highest affinity of almost any substance for trapping mercury and lead. And so if the person is exposed to that, it reacts with oxalate and forms a insoluble crystal, and then those insoluble crystals form inside all the different tissues in the body. And so whatever toxic metal you're exposed to is being kept instead of being eliminated. So one of the best things you can do if you're exposed to toxic metals is one of the ways to eliminate them is use the lowest oxalate diet that you can find. So unfortunately, all these people with their spinach salads and green smoothies have stored up tremendous amounts of toxic metals in their body, which becomes worse and worse as they get older. So really, in some ways, aging isn't losing function, it's just an accumulation of toxic factors. So each year you accumulate a little more toxic chemical at some time it reaches a tipping point, and you begin to have a bunch of negative health effects due to the long-term accumulation of toxic substances like lead and mercury and other toxic metals.
Yeah, I love that you said that. I absolutely agree with that because there's too much evidence of healthy individuals around the world living into their hundreds, etc. But here in the United States, we're so toxic and have less than enviable diets, etc. And people are succumbing to toxicity, not old age. And so I think people
That's right.
can live a very long time into old age and be very healthy if they play their cards right. So, what are some other signs? What are the typical health signs that you have oxalates?
It can be almost anything. So, for example, vulvodynia, where the women have the reproductive tract is raw and painful. This can be due to deposits of oxalates in the vagina and the rest of the reproductive tract. And the treatment is the same in each case, which is use a low oxalate diet, treat candida or other fungus that may be there, and of course, vaginal candida is extremely common, and use calcium and magnesium citrate as nutritional supplements. For an adult, 300 milligrams of calcium citrate and 100 milligrams of magnesium citrate with each meal. And it has to be with the meal. You can't, if you miss a meal, you can't take more at the next meal because these citrate forms help to prevent the oxalates from being absorbed. So they have to be taken with the meal. And then another very important factor is vitamin B6. So in the body, there's a branch point, and and precursors of oxalate can go two ways. If they go one way, they form oxalate, and so the body can produce oxalates as well. If there's adequate B6, the body converts these precursors to glycine, which is not toxic at all compared to oxalate. And so having adequate B6 is a very important health factor. And this is something that everybody can do because B6 is one of the least toxic nutritional substances. A dose of 100 milligrams a day is very safe. So there's almost never side effects at that dose for an adult. And at that dose, there is a significant increase in life expectancy. So a study was done in Texas where a family physician put a part of his patients on B6 at 100 milligrams a day and the other not. And the patients on B6 lived an average of 8 years longer than the patients not getting B6. So about the only side effect of B6 is longer life.
Yeah. Yeah, and are there any other supplements one can take to dissolve oxalates? I've heard that essential oil of lemon, which is basically pure potassium citrate, can be helpful as well.
Yeah, so that's another one. So citrate of any form is helpful, and it's found if you do the organic acid test. People with low citric acid in their urine would be more susceptible to problems with oxalates. Taking more magnesium in general, magnesium citrate is the best form, but any form of magnesium is helpful because it helps to dissolve oxalates. And drinking a lot of water is important. It's been found people are much more likely to have kidney stones in the southern United States than in the north, just because it's hotter and people get dehydrated. So people who are dehydrated are much more likely to have kidney stones, but also these crystals of oxalate in their other organs as well. One of the most dramatic side effects of the high oxalate is they can form in the eyes, and so it's a common factor in children with autism, and part of it's due to a lot of those children are on a milk-free diet, and so aren't getting an adequate amounts of calcium. So these oxalate crystals form in their eye, and more than 20 children with autism actually pulled their own eyes out because the pain was so bad that they couldn't tolerate it anymore. So the oxalate crystals, and at autopsy, it's found that these crystals do indeed form in the eye. They can form in the thyroid gland and cause thyroid disorder. In a series of autopsies, it was found significant number of people had the oxalate crystals in their atherosclerotic lesions in their coronary arteries. And I suspect this is a very common problem. The finding of cholesterol in the arteries may be due to an attempt by the body to dam the damage done by the oxalates. So the oxalates have a direct negative effect on the production of the endothelial lining of the arteries. They have a pronounced effect on killing the cells that keep the artery walls smooth with the endothelial lining. And so I think this is a very important factor. So at some time, I don't know when this is going to happen, at some time there'll be a tremendous new interest in this thing. But right now, I think the manufacturers of statin drugs prefer to keep everybody's interest focused on cholesterol, even though low cholesterol is can be just as harmful as high cholesterol can.
Are there any other signs of oxalates? I know a lot of my clients that I found oxalates and they have really tight muscles, really painful, stiff muscles. Are there any other
Absolutely.
signs?
That is a sign. So what I suspect is perhaps the majority of patients with fibromyalgia, what the fibromyalgia pains are, I suspect, is the oxalate crystals being deposited in the muscle cells, and and there are lots of slides available showing the oxalate crystals can form in the heart as well, and inhibit the transmission of the nerve signal that causes the heartbeat. So the oxalates can also cause arrhythmias as well if they're at such concentrations that they're impairing the conduction signal in the heart. So there's just a huge number. In some people, the oxalates will appear in the skin, and you can actually see them. You will see white specks of the crystals actually appearing in the skin, and if it gets severe enough, it causes the skin to become necrotic, and it'll just turn black. So initially, they may see these crystals in the skin itself, and then as more and more of these crystals, it'll just completely start to damage the skin, causing it to turn black and blue.
So do you think that anyone with kidney stones, that's without a doubt they have oxalate issues?
It's something like 80 to 90% of kidney stones are due to oxalate. So anybody who's ever had a kidney stone should be looking at this angle and should be tested, and probably also get the DNA testing. There are certain individuals who have the genes that are much more likely to result in kidney stones because they don't detoxify them as well, or the individual is producing higher amounts of oxalates than normal. So the DNA testing is going to be available, and it's something Great Plains is very interested in. We're planning on having that testing available in the fall.
What kind of testing?
The DNA
Oh, the
testing
DNA. Okay,
for
great.
for all the genes involved in oxalate
Oh,
metabolism.
fantastic. Yeah. Yeah, and so oxalates can also promote leaky gut, correct? If they
Yes.
perforate the gut
Yeah.
wall. And can you talk a
Yeah.
little about that and how gut infections, which are so prevalent in our society today, promote the production of oxalates?
Yeah. So one of the problems is the if there's not enough digestion and absorption of fat, some of the fats can bind calcium, and the non-absorbed fats bind calcium, and then the calcium can't combine with the oxalate, and that makes the oxalates be absorbed into the body. So if they form with calcium, then they precipitate out and they're lost in the stool. But if there's a lot of unabsorbed fat due to factors like GI infection, it's much more likely that oxalates will be absorbed into the body. So there's a wide range of problems that can be caused by the oxalates. They can form in the testes and cause reproductive problems in males. And maybe that's why men don't like to eat those spinach salads as much as the women do.
You have to go with their intuition on that one.
So, so a large number of the factors, oxalates at high amounts can deposit in the bone marrow, so the person can actually become anemic due to the fact that oxalates actually get into the bone marrow and crowd out the cells in the bone marrow that are producing the red cells and white cells. So the person can become anemic and also can have their immune system impaired because the oxalates are crowding out the cells that are responsible for immunity. So they're really bad players, and there is no known benefit to oxalates. It is purely considered to be a waste product, and and occasionally animals will have problems with the oxalates as well if they're eating certain foods in the pasture in the wild that are high in oxalates. The animals can have similar problems.
Yeah, and so yeast definitely will contribute to oxalate issues and production of oxalates. So whenever I have a
Yes.
client and they're talking about they've got long-standing candida issues, I automatically think they've probably got oxalate
They
issues too.
probably got oxalates, and so I see a very high correlation between those two factors. I have a friend who is a ENT, ear, nose, and throat specialist. Sorry for that.
That's okay.
and 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 he had a patient who had severe sinus problems and did an X-ray and found oxalate stalactites in the sinus of the patient, and it was because they had a mold infection of the sinuses. A few years ago, Mayo Clinic did a study, found that most sinus infections are due to fungus, not to bacteria, whereas the most common treatments are to give the person antibiotics, which of course cause the mold and fungus to proliferate and make the sinus problems worse. So he put the patient on an antifungal therapy, and a follow-up showed that the stalactites had disappeared.
Wow, that's mind-blowing to have stalactites in your sinuses.
And which brings up in the prison study of the prisons, we did extensive, we found that all of these prisoners did indeed have high oxalates, and one of them actually had severe stomach problems. On X-ray, it was found they had stalactites of oxalate in their stomach.
Wow. Gosh.
So the oxalates can be highly significant. The other thing that's oxalates are unique in that they're one of the few things that is absorbed primarily in the stomach. So most of the oxalates are absorbed in the stomach, only a smaller portion, perhaps 90%, with only maybe 10 or 20% being absorbed in the intestine.
Why is that?
I don't know. That's a
Okay.
very good question.
Like what? It's kind of like alcohol.
There's a
Alcohol is
research
absorbed in your
project
stomach
for
too.
you when you get your lab, or you make a big donation to a
Yeah.
laboratory. They'll find out why those oxalates are absorbed in the stomach.
Yeah.
What I suspect it is because the stomach is so acidic. It's like a pH of 1, which is extremely acidic, and at that pH, the oxalates are all in a form which I think is more easily absorbed. They're in it, whereas in the body, in the bloodstream, they're at a different pH, and they're probably somewhat less likely to be absorbed, whereas in the stomach, that very low pH allows them to be absorbed more readily.
So, any other signs of oxalates?
Let's see. So, I mean, it can almost be any medical problem. It could be having thyroid problems, because it's been found that the on individuals who have low thyroid, which is of course a very common problem, especially in women, that the individuals have the amount of thyroid hormone being produced is dramatically reduced if these oxalate crystals are forming in the thyroid gland. And one thing to remember is that in some people, if they have the oxalates, they don't necessarily have kidney stones. So at autopsy, they found there were a lot of people who had oxalate crystals in their thyroid, in their testes, in other organs in the body, but did not have oxalates in their kidneys or bladders. So what's interesting is that there's just a whole array of illnesses that can be associated with the oxalate problem. So I think it is, one of the great new possibilities for new medical therapies. A whole new approach in looking at this problem. And the value of the organic acid test is, we check the oxalates, but we check for the factors that contribute to, like the candida and fungus markers. We also check for the vitamin B6, which is B6 deficiency is one of the major factors associated with excessive oxalates. And we also check for the markers that are associated with genetic forms of oxalate problems.
Yeah.
So there is a wide range of information that helps. It was interesting as I was preparing a seminar. I came across a general physician general practitioner in the UK who was eating the green smoothie type of diet and had severe fibromyalgia. And the headline of the story was, "Throw out those healthy berries."
Yeah.
And so she got relief, and so she had been severely impaired. She had a fibromyalgia support group. Just 2 days of removing the high oxalate diet and changing to the so-called unhealthy diet of meat and potatoes, all her fibromyalgia pain was gone. And to prove it, she went back on the old diet, and within a short time, all her symptoms returned.
Yeah, and it's I think it's one of those things where if you have any kind of chronic pain syndrome and the doctors can't figure out what it is, I think definitely doing an organic acids test is the way to go.
That would be it. Yeah, and especially the fibromyalgia and chronic fatigue. So those are by far some of the more common things. And like I said, virtually every single kid with autism has the problem of the high oxalates.
And so when people are embarking on their low oxalate diet, do they have to be a little bit careful, not mixing all of the oxalates right away, because you start detoxing, you start releasing all these heavy metals that are bound into the oxalates. What are your thoughts on that to maybe kind of taper it slowly?
That could be a factor. So I think it would definitely be. I think it's definitely worthwhile to use the calcium and magnesium citrate at the same time, because the magnesium has the ability, if you put in high amounts of it, to displace the heavy metals from the oxalates. So one of the physicians who had heard my seminar was impressed and really started using magnesium supplements for a lot of her patients, and had extremely good results in reversing their problems with the magnesium supplementation, because it will displace the heavy metals from binding to the oxalate. So it'd be important to especially important to be drinking lots of water. And the
Thumbs up.
citrate is very useful. There you go. And the citrate. So any of the citrus beverages, of which there's plenty of those around, are just taking potassium citrate. I think you mentioned that. But anything containing citrate would be very helpful in that regard.
Yeah, I was reading on your website, the Great Plains Lab website, that there's a few other supplements that could possibly be good and
Yeah,
eradicating oxalates. One of them was arginine.
yeah. Arginine could be useful. Uh-huh.
How does that helpful?
It helps to prevent the crystals forming, and so were omega-3 fatty acids were useful as well.
Okay.
So those would be the other supplements. But the big one is to make sure of taking out the highest oxalate foods from the diet. That's probably the most important factor. Begin to reduce those, and so unfortunately, I think that that spinach is just not what the Popeye was really using. I'm convinced that Popeye was really eating these big cans of spinach, that he would, and rather than having big biceps, he would have muscles full of toxic oxalates
And crystals.
and crystals, and his muscles would very soon become necrotic.
Yeah. Yeah, so what other foods should you be avoiding that are really, really high in oxalates? I've heard wheatgrass juice can be really, really high. And do we just need to avoid a lot of the green vegetables, the leafy green vegetables?
Well, for example, lettuce is a good substitute. It's not nearly as high. Broccoli is good. Now, all vegetables have some amount of oxalate, so you can't you'd go crazy trying to if you tried to eliminate every oxalate containing food. Plus, even some of the amino acids in meat can be converted by the body to oxalate. So the only one you really have to worry about is gelatin. So gelatin doesn't contain any oxalates, but it has an amino acid hydroxyproline that the body can convert to oxalates. So that would be one of the foods you should consider eliminating
Oh, really?
is Jello.
Okay, Jello. Well, I know a lot of
And
people.
I like doing this because I never liked Jello anyway. So I get a perverse pleasure in knocking all these foods that I never liked to begin with. And
Yeah.
people always telling me I should eat these things because they were good for me.
Well, I think you're probably freaking out a lot of the listeners in the paleo community because a lot of them love to put Great Lakes gelatin and et cetera in their smoothies or their drinks or what have you. What exactly is the problem with how they can create oxalates?
Yeah. So the big thing is that gelatin has like perhaps 20% of the amino acids are this hydroxyproline that the body converts to oxalate. That's the big problem. There's no other substance. There's no other food that has anywhere near. So all proteins have a small amount of this hydroxy proline, but only gelatin has the huge amounts. And so, again, in animal studies, they showed if they put the animals on a diet supplemented with a lot of gelatin, that they developed very high oxalates in their urine
So,
within a short period of time.
wow.
So these things, again, if people are only eating them occasionally, it's probably not going to cause a problem. But if they think that this is the Rosetta Stone. They think that gelatin is the Rosetta Stone for all their food problems and start eating it daily. That's where they're going to run into problems.
Yeah, yeah, I think it's just the old saying, everything in moderation. You
Yep,
don't want to go too crazy with any one food, even if it's healthy. You can get too much of a good thing.
yep.
And so you said to test for oxalates, you want to do an organic acids test.
Yeah, which is you just need a small morning urine sample.
Yeah. Yeah, and I'm surprised. I've had a lot of clients that like, oh, I have an organic acids test already from Genova Labs or something, and they don't test for oxalates.
Yep.
Are there any other labs testing for oxalates?
Mayo Clinic,
Okay.
but you would have to do a separate test. The advantage of our test is it not only tests for oxalates, but it tests for all the things that related to it: candida, vitamin B6, and citrate, and the precursors of oxalates. So you get, we have the best testing available for the oxalate problem.
Yeah, I absolutely agree. It's just it amazes me that there's so many amazing labs out there, and they're just so myopic and not testing for or catching this very common problem.
Yeah, yeah. So it is. So there is a high percentage of abnormality is one of the most common abnormalities that I find. So it it there must be consequences for many different illnesses, but a lot of people unfortunately are missing that information.
Yeah. And how long does it take to get rid of oxalates?
Well, according to this physician, it only took her 2 days. I don't think she was rid of it, but she was rid of a lot of the symptoms of it. Um, it can sometimes take months for because these things do accumulate in the tissue, and it will be a step by step situation. They won't all, most of the time they're not going to be all solubilized simultaneously. The it will be controlled by the body, and they'll be gradually removed. I guess it's possible there might be a few cases where there's too much, and then you could end up with kidney stones. But I think ordinarily the body will regulate itself, and these things will be slowly eliminated over time. But for the person who's been on one of these high oxalate diets for a long time, I would say it probably takes several months before the body removes a significant or most of these oxalate deposits. What I suspect too is that this is another factor in women's health. Is It's been found individuals with high oxalates, the oxalate actually gets into the bone structure. So the oxalate is forming in the bone crystals by reacting with the calcium, and it markedly weakens the bone. So I think that's why some of the older women are having problem with breaking bones and broken hips. And if they've had this oxalate problem and they have large deposits of this, it may take months, or perhaps even some cases a year or more before these things are all gotten rid of.
Yeah, yeah. Well, Dr. Shaw, thank you so much for coming on the podcast. I really, really appreciate it. It was so good. And I was so excited to have you on the podcast to talk about this because I realized how pressing an issue the oxalate prevalence is in our society and contributing to our health issues.
Well, it was my pleasure.
Yes.
Thank you very much.
Yes. And I have one more question I'd like to ask you.
Yeah.
What do you think is the most pressing health issue in the world today?
The most pressing health issue, I think, is the rate of change of technology. That that we are altering the entire biosphere so rapidly with things like genetically modified foods that require very toxic herbicides or pesticides to go together with the genetically modified, like the GMO soy and the GMO corn that require Roundup, or which is the glyphosate, or there's new ones that are going to require 2,4-D. So all of these things are being introduced into our society at an extremely rapid rate, and it sometimes takes 30 or 40 years to determine the toxicity of these things. And so our ability to introduce new products and alter the entire biosphere of the earth, that ability is dangerous, because we don't have time to assess what we're actually doing. We're making huge changes without knowing what the long-term effects are, and I think this is made even more dangerous because of the huge population of the earth. I don't know what the easy answer is. I've thought that there may need to be some fundamental change in families. Maybe we all can't have a bunch of kids, if we're going to save the earth, because with the huge population, that makes it even more difficult, because the argument for all these genetically modified foods is we're going to have to do this to support the huge population we have. So I think that we're going to have to find some way of at some time of, and hopefully voluntarily, limiting the human population back to maybe the numbers that were in the year 1900, and also putting a lot more stringent regulations on the introductions of new chemicals and technology, and obviously global warming. So all of these things are related to the huge human population and the profit motive of chemical companies producing new products that are introduced without adequate oversight. So those are the biggest problems that I see, and are the toughest challenges. And I think we should be asking our presidential candidates questions about these things. How are they going to deal with these issues?
Yeah, it seems now they're just getting paid with corporate lobbyists and
Yeah.
being paid under the table, and they turn a blind eye to it. So it's probably not
Yep.
going to change. That's why I advocate infrared saunas, to just sweat out all these chemicals. It's probably going to be the only insurance people can have against the toxic effects of all these chemicals synergistically in our body.
And that's a great, I'm glad you brought that up, because that's a great way for a person to detoxify most of these toxic chemicals.
Yeah, absolutely. Well, Dr. Shaw, can you tell the listeners where they can find you, and anything that you're up to in the future, any research projects, etc.?
Yep. So one of the new exciting research projects that's just come out is the phospholipase. It is the toxin produced by rattlesnakes. It's in rattlesnake poison, and it is the most common molecule produced in inflammation. So it's toxic for exactly the same reason that rattlesnake venom is toxic, because it causes the production of too many molecules that cause pain and inflammation. And so this test just became available. I'm very excited, and I think it will apply to virtually every chronic illness. It has an involvement with this molecule. And what's so exciting is that there's a simple nutritional supplement that can reverse that particular problem. And also, we're just on the verge of the introduction of a urine test for 165 chemicals in the urine
Wow.
for non-metal toxic substances.
Ooh,
So
I'm excited about that
herbicides,
one.
pesticides, phthalates, the whole gamut of common toxic chemicals. And I mentioned also in the fall we'll have one of the most comprehensive SNP assays that's available anywhere
Oh, wow.
for looking at a lot of different factors that I think are important. I mentioned oxalates, but there are many other pathways that are not getting attention. And so it'll be one of the most comprehensive SNP panels available anywhere. So look for that in the fall.
Yeah. Yeah, I'm
Look
really
at the
excited.
website.
Yeah, what's the website again?
The website is gpl4u.com. That's GPL is the acronym for Great Plains Laboratory, the number 4, the letter U.com. So gpl4u.com. And on the website, there is about 100 different webinars that are available, that are archived, that you can look at any time on a whole host of interesting topics for different diseases. So I think you would find that extremely interesting. So it's a great resource that you can look at 2 in the morning if you have insomnia.
Yeah. The oxalate pain, it's keeping you up. Well, Dr. Shaw, thank you so much for coming on the show. I really, really appreciate your
Okay.
time.
Yeah, thank you again. It was a great pleasure.
Everyone, thank you so much for listening to the Live to 110 podcast. I wanted to give you a few tips and resources on how to address your oxalates and support groups that you can join. Certainly there's groups on Facebook as well, but you can go to lowoxalate.info. Lots of information there about a low oxalate diet. You can also join the low oxalate group on Yahoo. This is one of the biggest groups on oxalates where you can get information and support. Go to oxvox.com, oxvox.com, and click on the How of Low Oxalates. Then click on the Why Join the TLO group. At the bottom of the page is very specific instructions on joining the Yahoo group. And after you apply, Yahoo will email you back when you're accepted, and they'll send you an email, all kinds of information. And on the group, they've got food lists, supplement lists, and other links, etc., that are very, very helpful in your endeavor to eat a low oxalate diet and get rid of your oxalates. If you need to do testing for oxalates, I do testing. I'm a functional and diagnostic nutritionist, so I can do the organic acids test by Great Plains Lab, offered by Dr. William Shaw. Just go to store.live to110.com and click on functional diagnostic tests, and then click on the OAT or organic acids test, and I will happy to run that for you and give you a very thorough interpretation of the test and recommendations to reduce your oxalates. You can go to my website at live to110.com to learn more about natural, alternative methods to address your health conditions, natural means to reduce or eliminate your health conditions. You can learn about my version of paleo, the modern paleo diet, and all about my favorite subject, detoxification in our toxic modern world. Thank you so much for listening to the Live to 110.
Be with you.
Yes, I know we do a lot of talking on the phone or on Skype. We're definitely becoming very, very good friends. So I'm really happy to have you on the podcast and love having you as a mentor and colleague. Really have learned a lot from you. So why don't you tell the listeners a little bit about yourself and your story and how you got interested in hair mineral analysis and metal toxicology?
Righty. Well, I was born and bred here in Melbourne. Did my training in medicine and surgery at the University of Melbourne and graduated in 1980. Much of my professional career I've spent as a family general medical practitioner, just doing the routine sorts of things. And it was very interesting, but I found that there were a proportion of patients who you could never really help. You do all the standard medical tests that all come back pretty much negative, occasionally sort of something a bit odd here or a bit odd there, but overall, these patients were sick patients, but you could never, with conventional medical testing, really work out what was going on. So some years later, I decided that, for personal reasons, more out of curiosity than anything else, I decided to send off some of my hair to do a hair mineral analysis. And lo and behold, there are all sorts of unusual things on it, like lots of arsenic and some aluminium and sort of all these funny sort of things like sodium and potassium going through the roof. I couldn't make head or tail of it. So then I went to a lecture, or actually a seminar really, run by a laboratory here called Interclinical Laboratories, who are the Australian distributors for Trace Elements Incorporated, and opened my eyes to what hair mineral analysis could really offer for someone in their life. It just uncovers an enormous amount of biochemistry, a whole lot of physiology and toxicology that you cannot simply do with blood tests or urine tests. They just don't give you the same data. And of course, with a hair test, you're testing tissue levels. Hair grows at about 1 centimetre a month on the scalp. And so when you harvest hair from the back of the head or the nape of the neck, you're actually looking at a snapshot of what has been happening biologically in a person's life